Hello, good evening, everybody. Welcome to it's Wednesday, it should be Tuesday, but we call it our Tech Tuesday anyway. And it's my weekly little bit of a deep dive, slightly more technical take on nutrition and how it works and how it doesn't work. So I'm essentially running a series on certain conditions. Now, please note that I am not giving any medical advice on this particular channel. I am simply rehashing some information that I get from a lot of various different medical sites. And it's information that may or may not be helpful. If you do have any of the medical challenges that I talk about, then please see a suitably qualified doctor or physician who can correctly diagnose you and treat you correctly. The information I'm giving you here is simply educational and may be of help, but there's been no backup scientific evidence or not sufficient backup scientific evidence to actually prove that any of the information that I'm saying is a cure for anything. I do not advocate any cures. That is up to the doctors to prescribe and to treat. All I'm doing is giving you some nutritional information that may or may not help in your particular case. So having said that, I am covering a new subject tonight, or a new little series, and it's quite a galling subject, I guess, but it's something that I'm seeing quite regularly these days. And the fancy medical term for it is called cholecystitis. I am not swearing at you, but this involves your gallbladder. And your gallbladder plays a fairly important role in your digestion. But if it gets blocked up or inflamed or infected, it can cause some serious discomfort in your gut and make you feel very much of a not happy camper. Now, part of the reason why I'm covering this is because I've been seeing quite a few patients just recently. I work closely with a few general surgeons, and between them and between the different hospitals, they are taking out numerous gallbladders every single week. And I see these patients, specifically with my one surgeon, very, very regularly. So whenever he decides to operate and take out a gallbladder, which is known as a cholecystectomy, then I get to go and assist, and not in theatre, but assist with treatment post-op to try and help to prevent any further complications. But the fact of the matter is I'm seeing a good 1 to 2, sometimes more, gallbladder procedures being done every week. So gallbladder problems obviously are quite common, and in my opinion, shouldn't be that common, but they are because of diet-related issues, which is why it is so important to have a good balanced diet as well as a good healthy lifestyle, because it can make or break your comfort or discomfort in this particular case. So let me share my screen and basically go through a little bit about what is a gallbladder, what does it do, what doesn't it do, and why does it give us so much grief? Just shrink me down over here. So, as I said, this fancy medical term is called cholecystitis. And the subtitle over here is, what is it? And why is our gallbladder so important? So what is the gallbladder? Most people will probably be familiar with the terminology of gall or bladder. You all know what a bladder is, but the gallbladder is another little thing that forms part of our digestive system. So the gallbladder is a small pear-shaped organ on the right side of the belly, just under the liver. And it holds fluid that digests food. And this fluid is called bile. So if you have been binging on junk food, or you've splurged and you've overeaten, and you have that not quite a nauseous feeling, but you've got that really horrible bitter stuff that comes up in your throat, and you sort of swallow hard to get it down again. And essentially, without trying to be too gross, when you vomit, that horrible bitter aftertaste is the bile that you're tasting and feeling that's coming up and irritating your throat. And the gallbladder releases bile into the small intestine. And most often, gallstones that block the tube leading out of the gallbladder cause this thing called cholecystitis. You probably have heard of kidney stones. Well, you also get gallstones. Similar sort of principle in that it's stone describing something hard that blocks up these little tubes. Most of the tubes in our body are extremely thin and small, but also flexible. Now, if you take a straw, for instance, a drinking straw, and you suck fluid up through it, it flows through pretty easily. Now, if you've ever had a milkshake that's got a lot of ice and ice cream in it, and you're sucking up through that straw, sometimes those little ice crystals block up the tip of the straw. So you've either got to suck really hard to get anything through it, or when you do that, suddenly the smaller stones or smaller little crystals shoot through and hit you in the back of the throat. Quite often you end up coughing a little bit, but that essentially is what happens in your bladder and your gallbladder. Is think of those little ice crystals that block up that tube, and now fluid can't get through. And this results in a bile buildup that can cause inflammation. Remember, all disease is caused by inflammation. So other causes of cholecystitis include things like bile duct changes for whatever reasons, tumors, again a blockage, serious illness, and certain infections that can all cause inflammation in that area. If not treated, cholecystitis can lead to serious complications such as a gallbladder rupture, and that results in emergency surgery. Trust me, you do not want to have to undergo emergency gut surgery, because it is not fun, and the end results can be quite traumatic and painful. It is much better if you really need to have surgery. It's much better to plan it than to have an emergency, because planning results in a much better end result with less pain and better healing all around. So again, it's always better, cheaper, and a whole lot less painful to prevent a problem than to treat a problem. And these complications can be life-threatening, as I said. Treatment for cholecystitis often involves surgery to remove the gallbladder. Usually they go in what they call a procedure called laparoscopic, meaning they're using a camera. But if there are complications or problems, then they have to do what they call open surgery. And yes, a lot more issues are at play in this case. So what is this cholecystitis? And that's it. The definition of cholecystitis is when your gallbladder is inflamed. So anything that says itis means inflammation, like arthritis. That itis at the end is inflammation. Gallbladder inflammation can be caused by gallstones, which is most often the result, because cholecystitis is the result of hard particles of bile that can form in the gallbladder. And these are called gallstones. And gallstones can block the tube that carries bile when it leaves the gallbladder. And the tube is called the cystic duct. And bile builds up in the gallbladder, causing swelling and irritation. And just like your urine bladder, if you can't go in a hurry and you feel your bladder expanding, it's very, very uncomfortable. And the same happens with your gallbladder. It's very, very uncomfortable and causes a lot more issues over there. And that swelling and irritation can make you feel decidedly ill, for want of any better terminology. And these little stones can, and I don't want to sound too gross over here, but I love having a look at them after the surgery. Sometimes they can be quite large things and maybe only one or two, but sometimes it can look like gravel, very fine gravel that comes out. And when I see that, I can then explain to the patient and they understand why they were feeling so horribly uncomfortable up until that time. The other thing that causes it is a tumor. And a tumor may keep bile from draining out of the gallbladder as it should. And this causes bile buildup that can lead to cholecystitis. Now, a tumor isn't going to be hard like a particle or stone, but it can constrict. So it can basically almost tie a knot in it in the tube or block it up. It's like, again, stuffing a balloon down a straw. It's can generally, if it's small enough, it'll go down, but if you start to inflate it, suddenly fluid doesn't go through there. And then you have a bile duct blockage. Stones or thickened bile in tiny particles called sludge, and it really does look like sludge, can block the bile duct and lead to cholecystitis. Kinking or scarring of the bile ducts can also cause blockage. So maybe in the past you've had a bit of inflammation and you've had some tiny little particles of bile go through there and they've scratched the side of that tube, which causes scarring. Some people scar more easily than others. And I know I've got various scars on me, various things. And sometimes just a little scratch can cause a scar, but sometimes a tear can also cause a scar. Or it can put a little bit of a kink in there and cause a problem as well. An infection, things such as AIDS and other infections caused by viruses, can also cause gallbladder swelling and irritation. Serious illness, now very serious illness, can damage blood vessels and lessen blood flow to the gallbladder. And those too can lead to inflammation. So what are some of the complications of this? If not treated, cholecystitis can lead to serious complications, including things like infection within the gallbladder. If bile builds up in the gallbladder, the bile itself may get infected. You could have death of gallbladder tissue. And cholecystitis that isn't treated can cause tissue in the gallbladder to die. And this is called gangrene. This most common complication mainly affects older people or those who wait to get treatment and those with diabetes. And gangrene can lead to a tear in the gallbladder, or it may cause the gallbladder to burst. This is an emergency case. You will be in some serious pain, and it is highly recommended that you get to hospital as soon as possible. And I can about guarantee you, you will have emergency surgery to take their gallbladder out before it causes major, major infection and ultimately death. So this is why it is always so important to listen to your body. I always quote the book written by Dr. Jim McAfee called Your Body's Sign Language. I find this an absolutely fascinating book. It is a book that was written by Dr. Jim McAfee, who is a clinical nutritionist. And in fact, that book is recommended as a textbook for people studying clinical nutrition because he puts things out so clearly and so well that it explains everything in simple language. And little signs is your body that's simply saying, hello, there's a problem. We can ignore that sign, or we can listen to the sign and monitor it. If it's minor, like a headache, for instance, a headache could simply mean that you're dehydrated, or it could mean eye strain, or you've basically been putting your head down for too long and you got strain on the muscles in the back of your neck. But a headache can also mean things, could mean serious illnesses like meningitis, or worse, a tumor. So we've got to listen to the signs and work out, or at least describe them to a doctor to work out what is causing that sign. I often say, you drive a car and you're driving along and suddenly your little water light comes on. It's a little red light on the dashboard that says, shows a little watering can. It could mean simply that your water level is a bit low because you haven't checked it for the last 18 months. Or it could mean that you've got a leak in your radiator. Or it could mean that you've got a blown head gasket. You don't know until you stop and you check, or you get it to a mechanic who can, these days, plug it into a computer to diagnose what the problem is. And unfortunately, we can't get plugged into a computer, although in some cases that does happen. We've got to look at the signs and see what is causing that problem. And the way that a doctor diagnoses any condition, unless it's a very simple thing, you've fallen and broken your leg, and you've taken an x-ray and you can see the bone is broken. When it comes to medical conditions, your doctor has to essentially rule out what the problem isn't until he can figure out what the problem is. So when you've got these little signs, you've got to try and deduce what the problem isn't. The other complication is a torn gallbladder. A tear, or which is also known as a perforation in the gallbladder, may result from gallbladder swelling or infection or death of gallbladder tissue. Again, medical emergency. So how do we prevent these problems? Because, as I've always said, prevention is a whole lot less painful and significantly cheaper than trying to fix a problem. You can reduce your risk of cholecystitis by taking the following steps to prevent the gallstones in the first place. First of all, if you are overweight, lose weight slowly. Fast weight loss can raise the risk of gallstones. In other words, you want to lose roughly 1 kilo per week. If you are hyper overweight, and I'm talking 150 to like 200 plus kilograms, and yes, there are people out there who are those weights, you can possibly afford to lose maybe about 2 to 3 kilograms a day. But if you are within a slightly overweight level, you don't want to lose it that fast because you're going to have problems. You need to be at a healthy weight. Being overweight makes you more likely to get gallstones. And to get to a healthy weight, you need to cut calories and increase your physical activity. And then you need to stay at a healthy weight through healthy eating and exercise. Again, balanced diet, healthy lifestyle. This does not mean that you have to go out, join the local gym, and spend 5 hours a day pushing weights and working out. It's not that at all. And your healthy weight as well. We've been over this countless times. It's simply you need to burn more calories than you're taking in. And if you don't know how to do that, I would suggest that you speak to somebody, first of all, who has done it in a healthy way, or a better option would be to speak to your dietitian or even clinical nutritionist if you have that option. No disrespect to doctors, but they are not going to be that good a source of teaching you how to eat correctly, or to lose weight in a healthy manner, they're going to work with a dietitian in most cases. And you need to choose a healthy eating plan, because a healthy eating plan is so simple to say, not always easy to do. So eating foods high in fat and low in fiber may raise the risk of gallstones. To lower your risk, rather eat a lot of fruits, vegetables, and whole grains. And as a result of that, also fiber. So what is the diet and the gallstone risk? There are a number of risk factors that contribute to the formation of gallstones, including a family history of gallstones and gender. So again, there's certain things that you can control and certain things that you can't control. You can't control your gender. You are born one or the other, unfortunately. And you really can't control your family genes. Unfortunately, you cannot choose your family. You can choose your friends, but you can't choose your family. So those things are something that are pretty much, sorry, that's what you were born with. That's the cards that you were dealt with. But there are a couple of other things that you can control. Now, unfortunately, women are twice as likely as men to develop gallstones. And I can attest to this because I generally see more ladies than men with gallstones, but I do still see men with gallstones and having had their gallbladders removed. Body weight is also a factor. The risk of gallstones is higher in people who are overweight and obese. Diets that are high in fat and cholesterol and low in fiber appear to play a role in this whole story. There is a link between quick weight loss and gallstone formation. Crash or yo-yo diets can cause the liver to release more cholesterol into the bile, disrupting the normal balance of cholesterol and bile salts. That extra cholesterol can form into crystals, and this leads to gallstones. So, what are some healthy foods to look at for the gallbladder? Whether or not you are at risk for gallstones, it's always a good idea to keep your body at a healthy weight and eat a diet that is low in fat and cholesterol, moderate in calories, and high in fiber. Remember, fiber is considered nature's broom. Just like in your house, you can drop a whole lot of dust or mess on the floor, and you can blow it along and get it in a pile. You can take your hands and scoop it into a pile. But in order to clean the area, you've got to sweep it out. And whether you sweep it with a brush into a dustpan or just simply sweep it out of the door, you've got to sweep it out. And the same thing happens in our body. So you can take all these fancy things to lower your cholesterol or prevent it from oxidizing in the body, but you've now got to get rid of that waste. You don't want it building up inside. Same as you don't want that pile of dirt to build up inside your house. You can sweep it into a neat pile and leave it there. And then the next day something else happens and you sweep that into a neat pile and you leave it there. And you keep doing that. And before you look, you are trapped in your house because of all these large piles of dirt. You've got to sweep that stuff out. And exactly the same thing with fiber. You've got to get rid of all the excess fat and cholesterol in your body. The way that we do that is with fiber. All of the following are healthy foods for your gallbladder, as well as the rest of your body. Fresh fruits and vegetables, whole grains, things like whole wheat bread, brown rice, oats, bran cereal, lean meat, poultry, and fish. So meat itself isn't the problem. It's the amount of meat and the source of the meat. So for me, I like to eat things like ostrich, and whenever I've got a choice, venison, because you know that that is good, lean meat. And the risk of there being any funny stuff in there is minimal. And you need to look at the low-fat dairy products. Bit of a catch-22 situation over here. because dairy is good for quite a few things, but too much fat, again, specifically the wrong kind of fat, is bad for you. And certain foods have been studied for their potential to prevent gallbladder problems, or better yet, reduce the symptoms. For example, some research has indicated that drinking caffeinated coffee lowers the risk of gallstones in both men and women. So coffee isn't always the enemy. I know we often get told that coffee is bad for us, but just like everything, too much of anything is bad for you. Too much oxygen will kill you. Too much water will probably also kill you. Too little, on the other hand, also leads to problems. So just like with coffee itself isn't the problem. It's what goes with it. How much milk do you add to it? How much sugar do you add to it? All those little things. And I still want to do a talk at some stage on caffeine, because when I was doing some research on it, I found out that caffeine isn't the enemy we get told that it is. So one of these days I'll do a talk on that. And I think you'll find it quite interesting. Drinking moderate amounts of alcohol has also been linked to a reduced incidence of gallstones. And moderate doesn't mean 1 to 2 bottles a day. It means a small amount in a glass, possibly daily. That's the same as red wine. Most cardiologists will tell you you can have a small glass of red wine per day. Don't save them up for one big glass in a bottle at the end of the week. A little bit every day is much better for you. In one study, women who ate at least 1 serving of peanuts a day had a 20% lower chance of having their gallbladder removed compared to women who rarely ate peanuts or peanut butter. And that was an interesting one as well. But the evidence is still far too preliminary to recommend any of these foods solely for the purpose of preventing gallbladder problems. Now, as always, you got to look at the things that are good, and you got to look at the things that are bad. So what are the foods we need to avoid? And researchers say many gallbladder symptoms stem from the modern Western diet, which is high in refined carbohydrates and saturated fats. Again, I will reiterate that carbohydrates aren't the enemy. It's the refined or the simple carbohydrates that are the enemy. Your complex carbohydrates are good for you, the same as fat. We need some fat in our system. It's the saturated fats that are the problem. The unsaturated fats are good for you. So if you're having symptoms from gallstones, it's because as your gallbladder tries to squeeze, some of the gallstone is blocking the outflow of bile that is stored in your gallbladder. You're squeezing against a closed door, and that's why it hurts. If you eat fatty foods, that makes it squeeze more, because your bile is what breaks down that fat. Changing your diet won't get rid of gallstones that are already there, but eating a healthy, balanced variety of nutrients and limiting the amount of saturated fats and cholesterol-heavy foods you eat may help to ease your symptoms, because you're not making them any worse. So try to avoid or limit these high-fat foods in your diet. Things like fried foods, your junk foods, highly processed foods, your donuts, your pies, your cookies, whole milk dairy products like cheese, ice cream, or butter. And again, my opinion, please cross-check with a dietitian or your doctor, but I would say that in limited amounts, cheese, proper ice cream, as in whole milk ice cream, and butter isn't bad for you. Again, too much is bad. Your fatty red meats. Also steer clear of very low-calorie diets. If you are overweight, aim for a gradual weight loss of between 0.5 to 1 kilogram a week by sticking to a healthy well-balanced diet, and getting regular exercise. Unfortunately, too often, people who are overweight or obese suddenly wake up to the fact that, oh, my clothes seem to have shrunk over the last week or so, and they've forgotten how long it's taken for them to get there. And they decide that they suddenly want to lose all of that weight virtually overnight. And it doesn't work like that. So I'm going to stop around about there, and I will carry on this next week because we've still got about 5 minutes left. Does anybody have any comments or questions before I stop the recording?